PTSD is a psychiatric disorder that was introduced into the Diagnostic and Statistical Manual in the 1970s. It's a psychiatric disorder that is dependent on exposure to a stressful or traumatic experience. PTSD is indeed curable. In fact, PTSD is not considered to be a chronic psychological or psychiatric disorder. What we know from the research literature is that exposure to traumatic or stressful events is actually quite common in the population. Not everyone will go on to develop symptoms of PTSD, but those people that do will generally improve gradually over time without any intervention. So most people who suffer trauma and most people who suffer PTSD will not require any form of psychological or pharmacological intervention. I suspect that many people will know that they are suffering distress and anxiety associated with the exposure to traumatic events. Whether or not many people in the population understand that the symptoms or the experiences that they are having are reflective of PTSD, I'm not so sure. PTSD is a very well documented psychological disorder. However, many people may not be in the position to self-diagnose. I suspect that all psychiatric disorders come with some degree of stigma. Psychological and psychiatric disorders have historically been considered to be abnormal responses. However, it's now very well recognized that symptoms associated with PTSD are very natural and normal reactions to exposure to very adverse life events or very traumatizing events or experiences. So I think it's imperative that mental health professionals, psychologists, psychiatrists, doctors and so on try to make it clear to the population that PTSD, although it's a very debilitating disorder, that there is nothing terribly abnormal about it. It's a very natural and indeed maybe adaptive response to exposure to terribly distressing